So this video is for the central line removal. If you have not done this before, you can grab a buddy and your buddy could read off the policy and you all can do it together. The policy is found in Lippincott and Lippincott is found on the intranet. So first you would obtain an order for central line removal, review patient for chlorhexidine allergy, look up insertion documentation for length of catheter if that applies to your patient. Confirm patient's identity using two patient identifiers, and obtain baseline vital signs: heart rate, blood pressure, respiratory rate, and pulse ox. You want to wash hands and don non-sterile gloves, mask, and protective eyewear. Discontinue IV fluid administration. Position the patient so that the insertion site is at or below the level of the heart. Explain the procedure to the patient. Set up supplies. You'll need a suture removal kit, open petroleum impregnated gauze, sterile 2x2 gauze, and sterile transparent dressing or tape. Remove old dressing. And remove any sutures that may be present. Okay. Assess site for any redness, swelling, tenderness, or drainage. Prep site using aseptic technique with ChloroPrep. Allow to air dry. Place petroleum gauze and sterile 2x2 at insertion site. Instruct patient to inhale, then steadily exhale or hum as you remove the catheter with a steady pulling motion.
And I'm going to have you take a big deep breath in for me. And when you exhale, I'm going to pull this out.
If resistance is met while removing the line, don't forcibly remove it. Cover up dressing and notify the provider immediately to discuss options for successful removal. Apply immediate direct fingertip pressure to the actual insertion site with petroleum gauze and sterile gauze pad for 5 minutes until hemostasis is achieved. Inspect the catheter tip and measure the length of the catheter to ensure that the catheter has been completely removed. Discard catheter on absorbent pad. Apply transparent dressing over petroleum gauze and sterile gauze at the insertion site. Label with the date and time of removal and your initials. Inform patient that dressing should be removed in 24 hours. Instruct patient to report any signs of redness, swelling, tenderness, or drainage at the exit site to their provider. Dispose of the IV tubing and use equipment properly. Encourage patient to remain recumbent or in a sitting position for at least 30 minutes after catheter removal. This is not required for PICC removal. Obtain vital signs after 30-minute wait: heart rate, blood pressure, respiratory rate, and pulse ox. Also not required for PICC removal. Document date and time of catheter removal and the type of dressing applied. Note the condition of the insertion site, the condition of the catheter and its length, the reason the catheter was removed, interventions during removal, the patient's response, and whether a culture specimen was collected. Document patient teaching. This concludes our video on central line removal. If you have any questions, please feel free to talk to Tiffany, Keisha, Tim, or myself. Thank you.